Booyala, booyala, mama, eh. Booyala, booyala, mama, eh.
In 2010, the EXP Social Marketing Foundation was contracted to manage the social marketing of USAID's donated contraceptives to the private sector. The environment at that time showed an extremely low level of contraceptive use, as low as 17%, according to the Demographic and Health Survey of 2008. The reasons for low use were many. The social stigma around the use for women who had not had children or were unmarried, coupled with a strong gender bias in the community, where men were often the gatekeepers, this contributed to restricting access to contraceptive methods. Added to this was the public health bias at the time and the low political, traditional, and religious support in the community, as well as superstitions, myths, and misconceptions, all contributing to the challenges facing the project. USAID and the EXP Social Marketing Foundation identified three main objectives for the project aimed at addressing these challenges. These were to increase the demand for contraceptive methods, to increase the access to contraceptive methods through improved distribution and retail coverage, and to look at improving the sustainability of contraceptive brands, moving them away from a donor-funded model to a commercially affordable and viable model. To achieve these objectives, the Foundation's strategy focused on three main pillars: to build behavior change communication campaigns that would make use of innovative experiential marketing elements aimed at personally engaging the audience, which would in time drive the increase in demand for contraceptive methods. Secondly, by improving the distributor capacity to increase the number of outlets stocking the project's contraceptive brands, the accessibility to the contraceptive methods would be addressed. Finally, through a strategy to launch two new cost-recoverable brands, the project hoped to make contraceptives affordable and sustainable. The tactical rollout of the strategy focused on demand creation. A 360-degree experiential approach was adopted to start and drive discussions around family planning. This was implemented across multiple channels, including brand-sponsored generic family planning radio call-in programs hosted by the Ghana Health Services. Each resource person was provided with a mobile phone and a dedicated line which was advertised during these radio shows, extending the link beyond the radio time. Roadshows, market day activations, and community festivals, which provided personal engagement with the target audience. The activation made use of edutainment and messaging together with a mobile clinic run by the Ghana Health Services, providing the opportunity for the audience to get more information and counselling. The program focused on involving health providers, motivating them personally, and adding credibility for the audience. EXP Social Marketing sponsors a variety of activities during the festival and promotes trial and use of its two brands, Protector and Challenger. These promotions include sponsoring football tournaments, boat racing, nightclub events, and bar activations. The results of the project were as follows. The project contributed to the couple's year's protection, or CYP, of 1,258,999 over 2 years. This increase in CYP in a developing country context is estimated to have prevented 262,572 unintended pregnancies and 27,409 unsafe abortions, as well as 668 maternal deaths. A major contributor to nationwide 6% increase from 17% in 2008 to 23% in 2011 in CPR, thereby reversing the trend of declining contraceptive use. CYP grew from 270,000 in 2009 to 495,000 in 2012 from 3 short-term methods. Increased retail coverage for 2 methods by more than 24%, universe of outlets approximately 12,600. A key element of this program was sustainability, and the project successfully launched 2 cost-recoverable brands and managed the price increases of those brands, allowing for a reduction in the subsidy and ultimately moving the brands towards commercial sustainability. If you would like to make use of the EXP Social Marketing Foundation, contact us on esminfo@expghana.com.